Okay, so moving forward here, let's talk about the pathologic application to the pressure volume loop. So let me switch colors here for the pathology section. Now, we did just go over the normal loop here in terms of these black arrows and this solid black line going around here. So what the questions are going to do is they're going to assume that you understand the normal, and they want you to take the patient that's in the clinical vignette and say, well, what do I think his diagnosis is? And if you're able to determine the diagnosis, they then want you to take it one step further and say, well, how would this patient's diagnosis or pathologic state change their pressure volume loop? Okay, so let's start off with this lime green line that's described as an increased preload. So basically what they're saying here is this is how the cardiac loop would change in somebody with an increased preload. Now, the question is not the fact that the clinical vignette is going to say this patient has an increased preload. So what you need to do here is you need to ask yourself, so in what states does a patient have an increase of volume or an increase of preload in their system? So I'll give you guys a second to think about that, but try to come up with a few answers as to when a patient's preload would be increased. Okay, so a couple examples that come to mind right away for me. Definitely the boards love questions about pregnancy, okay? So definitely realize that a patient that is presenting to the clinic for health maintenance will have an increased preload because plasma volume in pregnancy goes up between 30 and 40%. Okay, so it's fair to say that a patient who is pregnant would have an increased preload. And the second one would be a patient who is either over transfused, okay, during a surgery, or even somebody whose fluids are too high and they end up getting too much fluid. So these are all states of an increased preload. So basically what your questions will do is they'll give you one of those three settings and they'll give you multiple answer choices in terms of where the pressure volume loop would be changed. Okay, so for example, this would be letter A, this could be letter B, this could be C, D could be normal, and you can imagine all the variations they can have of this. Okay, so that's really all we could say about preload and the pressure volume loop. Okay, so let's go on to afterload. Okay, so this is definitely a board favorite here. So definitely think about which clinical circumstances would a patient actually have an increased afterload. Okay, and I'll give you guys a second to think about that again. Okay, so definitely one that I've seen ask is going to be a patient with systemic essential hypertension. Okay, so realize that 80 million people in the United States have systemic hypertension, okay? And that's going to be an instance where they have an increased afterload. So looking at this pressure volume loop, we see that the afterload here is going to be increased, okay? And what that means here is we see in the normal cardiac cycle, we said about pressure of 90, the blood starts to be ejected. Now, here with an increased afterload, we see that the pressure must exceed 140, okay, before you can get that ejection of blood flow. So definitely watch out for the question on essential hypertension. And something else that they like to ask in terms of an increased afterload is aortic stenosis. Okay, so remember, if that patient is 40 years old and they have an aortic stenosis, that's due to a congenital bicuspid aortic valve. Now, if the patient's 65 to 70-year-old, that aortic stenosis is more likely due to the calcific senile degeneration of the aortic valve. So different ways of getting the same result of an increased afterload here. Okay, so next here, let's move on to increased contractility. Okay, so as you can imagine, there's various ways that the boards can present somebody with an increased contractility. One example for sure is definitely a patient who's exercising. A second example would be, a patient that presents with hyperthyroidism. And even a third example would be, any arrhythmia where contractility is increased, such as a ventral tachycardia here. Okay, so basically what we see here is that the pressure again exceeds 140 at the peak of ejection here, and we do see the multiple clinical applications for the increase of contractility.